Today I'm talking to Dr. Chanpreet Arhi, who has done some research on referral for colorectal cancer, which we have published in this month's journal.
Essentially, what we found was that delays in primary care led to a worse outcome for colorectal cancer patients. This was in particular seen for patients turning up with red flag symptoms. So those kind of symptoms that you see that the NICE guidance suggests that you should refer, such as PR bleeding and anemia. And we found that if there was a delay in these patients, especially if there were over 2 weeks delay from the time that they saw the patient, time the GP saw the patient to the time that they sent the referral letter, this led to a delay. And the way we defined that was, what was the outcome? And the outcome was all-cause mortality and stage. And we found both that stage and also all-cause mortality was worse in these patients.
Tell me about the symptoms that you looked at.
Try to look at the myriad of symptoms that colorectal cancer patients could potentially present with. And we split these into the red flag symptoms, the things such as PR bleeding, anemia, change in bowel habit. And then we had another section called them non-specific symptoms. And these would be weight loss, abdominal pain, and constipation, for example. And what we found was that the ones with the red flag symptoms, those are the ones which had a worse outcome if there was a delay. This wasn't really seen with the patients with non-specific symptoms. And we looked into why this would be. And the way we did that was we took all the patients who had red flag symptoms, such as PR bleeding, and we kind of excluded anyone that had a delay. So everyone was referred within 2 weeks. And we found actually the patients presenting with PR bleeding had a better stage in the first place. So our thinking is that patients who are presenting with these rectal bleeding or anemia potentially are coming earlier in their pathway. And therefore there is that potential possibility, that opportunity to try to improve the prognosis for these patients by referring them in a timely manner.
Tell me a little bit about how you did the study.
Well, we used a national data set called the CPRD, or Clinical Practice Research Data Link. Essentially, it's a database of primary care records. And we were able, or CPRD for us, linked them to the cancer registry and also to hospital episode statistics. And so it kind of gave us a good idea about what's happening with a patient. Actually, we ended up having around 7,000 patients as part of this study.
What is your key message for GPs?
First key message is that we should use the NICE guidance. If the patient does present with PR bleeding and they fulfill the criteria, I think it's important to take the opportunity to refer to secondary care. Secondly, I identified from this study that it's very difficult to be a GP because you are essentially trying to differentiate the one cancer or the two cancers out of 100 patients with the same symptoms. And I don't believe, though, that the NICE guidance in itself would be sufficient to try to improve the prognosis for patients. There has to be other elements. Now, there is, since the study was written, since the study was carried out, there are more direct-to-test opportunities. There is now, with the COVID pandemic, we've got the FIT test coming through. And so it'll be interesting to see whether these changes actually make a difference as much as referring the patient when they present.
Today, I've been talking to Dr. Chanpreet Arhi, whose research has been published in this month's issue of BJGP. Thank you very much, Chanpreet.
Thank you.